This is the video on levels of consciousness. Consciousness is defined as a state of awareness of one's own existence and experience, but it's much more difficult than that to define. It is a state of being aware that we are conscious. There are several dimensions to consciousness that researchers look toward. They are theory of mind, mirror recognition, imitation, empathy and emotion, tool use, language, and metacognition. So let's go through them. Theory of mind is the recognition that others can think, have beliefs, and have desires that are different from our own. This aspect of consciousness is pretty distinct for only humans, although it is thought that some chimpanzees also respond to the theory of mind. Mirror recognition is being able to recognize oneself as depicted in a mirror. We often have a laugh as a cat or a dog tries to attack its own image in a mirror, as they don't recognize themselves in the reflection. Imitation is the ability to mimic the actions of others. When it comes to empathy and emotion, most animals are capable of experiencing basic emotions, including pleasure. This seems to be a low bar for the definition of consciousness, however. Tool use is the ability to use an object to achieve a goal. Many animals can use objects for this reason, including otters and birds. Language use is considered to be in the domain of humans only, as it includes the use of arbitrary symbols being associated with specific meanings and used within a strict grammar to convey information. Metacognition is being able to consider the contents of one's own thoughts, or, in essence, thinking about thinking. As a neurosurgeon, it is easier to define unconscious than conscious. People who are not conscious are considered to be in a coma. There are levels to coma that can be tested by a physician, and these levels are well documented. The level of coma is a predictor for prognosis. The basic coma scale, called the Glasgow Coma Scale, measures a person's response in 3 different areas. First is opening the eyes. If a person opens their eyes spontaneously, they score 4 points. If they open their eyes when their name is called, they score 3 points. If they open their eyes to pain, they score 2 points. And if they do not open their eyes under any circumstance, they score 1 point. The second area to the Glasgow Coma Scale is verbal response. If a person is oriented to time, place, and person, they score 5 points. This means they know what day it is, where they are, and who they are. If they are confused or disoriented, they score 4 points. If they speak using inappropriate words, they score 3 points. And if they just make incomprehensible sounds, they score 2 points. If they don't respond at all, they score 1 point. The third area is the motor response. If a person can follow commands, they score 6 points. If a person moves away from painful stimuli, they score 5 points. If the pain causes a flexed withdrawal, they score 4 points. If the flexion response is abnormal to painful stimuli, they score 3 points. If their arm extends to pain, they score 2 points. And if there's no response at all to pain, they score 1 point. The best response to the Glasgow Coma Scale is 15. This means a person is not in a coma. The typical coma patient will score 8 or less on the Glasgow Coma Scale. Someone totally unresponsive will score a 3. Even a dead person will score a 3. EEGs and fMRIs have been used in research to determine the centers for levels of consciousness, But these studies are hard to interpret as they obviously show activity in the comatose patient as well as the awake patient. Studies are being done as to which sections of the brain are required to be active for consciousness. There are no easy answers. And this is the end of the video on the levels of consciousness.